I had a heart event in March, I think, and last year, and I was 8 hours in emergency waiting.
Hmm.
You know, so like, does the People's Party have a plan to address those issues from a practical perspective?
Yes. So, but before we answer that, we should stress that healthcare constitutionally is a provincial jurisdiction. So, in a perfect
Hmm.
world, the People's Party would have no say whatsoever. However, we do have transfers, and the government is using transfers to their advantage. So, let's say that the People's Party gets in, and in the short term, they do want to take advantage of that transfer system to fix the healthcare system. One way to do that would be to say, let's work together and let's set up a system where if people want to fast track, if they have the means, rather than this a woman who had vertigo going to the U.S., let's get those dollars and let's spend them here. We have a word for this. It's called a two-tier system. It's obviously going to get some opposition from government because government will see that as a threat. Private sector encroaching on what they see as their domain. But that's a short term solution that will help alleviate some pressure. As you mentioned, you have to wait. I believe you said 8 hours because the system is just completely overburdened, and that brings me to and now this is my opinion. This is not PPC policy, but in my opinion, the reason that the healthcare system is in such bad shape is because of what I'm calling the health cartel. So these colleges of physicians, they're at the provincial, federal, and also international level. And they come in, and not only do they increase bureaucracy, which increases cost, but they directly interfere with the free market. So they certify universities in BC, for example. UBC is the only university that can give you a medical license to become a doctor, and UBC sets the number of doctors. Now, you could make an argument that sure, that's the right thing to do because UBC knows best. Okay, but when like when you have a shortage of doctors and UBC sets the number of doctors, and the government essentially controls UBC, that right there, A, B to C, that's the government's fault. It seems clear as day to me. We need to start dismantling that system. And if you don't want to fully dismantle it, and if you want to keep some regulatory bodies, it has to have more citizen control. Again, my view is only much more long term.